This morning in Living Healthy, it's a question many parents ask. When is the best time to take my child to the dentist? What's the right age and what will they need to have done? February is Children's Dental Health Month, and now is a great time to take your kids to see the dentist. South Coast Smiles is ready to see them. If you have little kids, you want them to be happy and smile.
The ADA is recommending that you bring your child in before their first birthday, typically when they start to cut their first teeth, which is generally around 5 to 6 months.
The sooner they see the dentist, the better.
The nice thing about getting kids in early is we can catch things very early. We can educate them very early, kind of get you on the right track for taking care of the kids' teeth for a lifetime, and it also just gets them used to the experience of meeting us, seeing us, being in the chair, so that way it makes for a better experience down the road.
The dentists at South Coast Smiles know your child may be a little nervous.
We have a lot of great techniques to make it a little bit easier for the kids. One thing that we do here is actually oral sedation dentistry for kids who are nervous or have a hard time with treatment. It's great because, you know, it's not as intense as like a general anesthesia. Just kind of helps take the edge off, make them a little bit more comfortable. We have TVs on all of the ceilings, so to help them relax and watch TV while they're getting their work done. And we also have different treatments that are, you know, much better for them in terms of early intervention of finding things, something like microabrasion, for example. If they're coming in early and we catch a cavity nice and early, we don't have to use a shot, there's no drill.
Parents, a child's diet has a big impact on their teeth.
Diet is one of the most important things, kind of limiting sugary substances as much as possible. But what a lot of people don't understand about the sugary substances is it's not exactly how much they're having, it's how often and the frequency in which that sugar is in contact with the teeth.
For young kids, get in the habit of brushing twice a day.
Trying to give them water as much as you can. Try to limit sugary substances to meal times, brushing regularly, kind of getting them in the habit of brushing their teeth. The ADA does recommend not using fluoridated toothpaste until about 2 years old, but even at that point, a pea-size amount, supervising them brushing. A lot of kids will want to brush their teeth on their own, but we do recommend supervising them until, you know, at least they can tie their shoes, we say, because, you know, at risk of swallowing the toothpaste.
Even small changes can lead to big problems.
If you notice any spots, you know, brown, even white, sometimes super white spots, these can be indications of early cavities. So that's the type of thing that if you're coming in regularly for your visits, we can find and take care of early. Don't be alarmed if you see, you know, it doesn't necessarily mean a problem, but it certainly helps to get it checked out.
And they also suggest dental sealants for your child's teeth for added protection from decay. It's a thin plastic coating that is painted on and is painless to do. It's one of the most cost-effective yet underutilized methods of preventing cavities in kids.